As coronavirus restrictions begin to lift, a look back and a peek forward in the state's most populated county. Has Yellowstone County done enough to keep COVID-19 at bay? And as we move forward, will residents continue to follow state and county steps to keep it that way? Well, we are getting some answers to those questions tonight and some thoughts about what might lie ahead as we transition to whatever the new normal looks like. Q2's Russ Riesinger joins us now from the newsroom tonight with some answers. Russ.
Well, Janelle, we've certainly seen a lot of County Health Officer John Felton this month, a month that in many ways, well, kind of feels like it lasted 4 or 5 months. But as we head into May, here's what the County Health Director is saying about the progress we've made and what could lie ahead.
The cost of failure to follow these guidelines is catastrophic.
Those are the things that make me concerned.
No one has been more front and center in the COVID-19 battle here in Yellowstone County than County Health Officer John Felton.
We've learned a lot about how to limit the spread of the virus.
And Felton says the social distancing that most of us have now become accustomed to has worked. Yellowstone County began April with 30 cases of the coronavirus and added another 50 cases in the course of the month. 2 people died.
I think Billings and Yellowstone County have done remarkably well. There's certainly a few people who think it's too much and have objected, and that is, we're still Americans, we still get the right to disagree.
Businesses which had been closed began opening this week. Restaurants, bars, and casinos followed this coming Monday.
We won't know the effects of the first phase of reopening for 2 to 3 weeks when we start seeing, when cases start to come out. So it takes some time just because of the incubation period for the disease, but there's no timeline on it. And I know people really want a timeline, but pandemics just don't work that way. They kind of go at their own pace.
As for what might be ahead as we turn the calendar to May, Felton had this to say.
I think at the end of May, we'll still have a lot of cases. We'll be still working on contact tracing. We'll still be gradually moving back towards what we used to think of as normal. The new normal will be here. I think we won't be doing a lot of large group things at that point. It's really important for people to realize that this is a stepwise approach back to a new normal.
Felton says another important thing that we've learned during this month has been that we can all come together if we share a common vision, and we can make some amazing results out of it. He says most of us have been doing our part, and that it shows in the low number of cases and hospitalizations so far here. Janelle?
Q2's Russ Riesinger, thank you so much.